This week on Healthy Living, we explore the impact of polio in society. Dr. Twahir Hemed explains the causes of polio and some of the best ways to prevent it. We will share some updates on the vaccination campaign against MPOX disease in the DRC. Plus, new research suggests farmers could boost their profits significantly with a simple pair of eyeglasses. We will have these stories and more in this edition of Healthy Living. Hello, I'm Kamiti Kibayasi. Thank you for joining us for another edition of Healthy Living. Poliomyelitis, or polio, is a highly infectious viral disease that largely affects children under 5 years of age. 1 in 200 infections leads to irreversible paralysis. Among those paralyzed, 5 to 10% die when their breathing muscles become immobilized. According to the World Health Organization, WHO, cases due to wild poliovirus decreased by over 99% since 1988, from an estimated 350,000 cases in more than 125 countries to just 2 countries as of October 2023. Africa being eradicated, polio has resurfaced in Ivory Coast, prompting action by authorities and support from various organizations to contain the outbreak. The resurgence primarily impacts children who are especially vulnerable due to widespread misconceptions about polio vaccination. VOA's Yasin Siu reports from Abidjan, Ivory Coast.
17-year-old Matthew has been paralyzed by polio since he was 8. The illness has kept him from attending school and living a normal life, creating a challenging situation, his mother says.
I saw children with polio on television. I never imagined this would happen to my child. If I had given him the vaccine, he wouldn't be like this. Given his condition, the neighbors say he's a sorcerer. My parents abandoned me and the child.
The debilitating disease has ravaged Matthew's body, who preferred only to use his first name due to stigma. He says he feels isolated and lonely as his friends have abandoned him.
Before, my friends would come and play with me. Now they visit, but they don't come near. I stay home and only play with my brothers. In the evening, I go to bed.
The World Health Organization says polio is a highly contagious virus that can cause paralysis, especially in children, and in severe cases, it can even be fatal. Health experts say the only protection is the vaccine, but misconceptions prevent many children from receiving the vaccination. Emmanuel Ello is a 26-year-old volunteer with YouReport, UNICEF's social messaging platform for young people to share their opinions on issues that matter to them. He recently participated in a polio vaccination campaign and says despite efforts to increase vaccination rates, some parents remain hesitant.
There are parents who refuse to vaccinate their children. There are some rumors that the polio vaccine contains harmful substances. Sometimes when you visit homes with children, parents claim they don't have children or that their children have already been vaccinated, but that is not true.
In a major step towards eradicating polio globally, the WHO declared Africa, including the Ivory Coast, quote, free of wild polio virus in November 2015. However, in recent years, another variant of the virus has emerged, and the Ivorian government, alongside international organizations like UNICEF, responded by intensifying efforts, especially in the most affected areas, says Dr. Abdul Fadiga, Health and HIV Program Chief.
We have detected polio cases in regions like Abidjan, San Pedro, Daloa, Abioso, and Bouaké. This is why our response is focused on these semi-rural areas.
Dr. Fadiga says organizations are now leveraging technological innovations to combat the spread of polio.
Today we have made advancements in vaccine technology. Previously, we relied on oral vaccines. Now we have injectable options. We also utilize technologies like the Open Data Kit, ODK system, used by the WHO to track polio cases. With these resources and the commitment of governments like Côte d'Ivoire, I'm confident that in a few years, we'll declare polio defeated, eradicated.
The WHO reported that the most recent detection of polio cases in the Ivory Coast occurred on April 23, 2024, highlighting the urgent need for vaccination efforts to combat polio's resurgence. For Yassine Siao in Abidjan, Ivory Coast, Anthony Labruto, VOA News.
Dr. Twahir Hemed is a pediatrician at Aga Khan Hospital in Mombasa, Kenya. He explains the types and symptoms of polio and shares some best practices.
Poliomyelitis is a full name of the disease that is of interest today. It is caused by a virus called the poliovirus. So there are three types of polioviruses, and they're known by the abbreviation WPV, which means wild poliovirus. Wild meaning that it is available in the environment. Okay, why is it referred to as wild versus the other type? Is that it is naturally available. It is naturally seen in the environment. One of the vaccines, and we can talk about this later on, has a non-wild poliovirus. And that's why, for the sake of the audiences, we say there are three types of viruses, and we mention and we name them as wild polioviruses 1, 2, and 3. Of the three, wild poliovirus 2 and wild poliovirus 3 have been eradicated, meaning they're no longer a disease causing, they're no longer out there causing diseases. So to answer your question, which is a common poliovirus that we are worried about that may cause disease, it is the wild poliovirus 1 that may cause the poliomyelitis disease. So the main important thing why the virus seems to like children under 5 is because they have not built up enough immunity to protect themselves. It may also attack the elderly for the same reason, because their immunity is now waning off. So if we can aim at these three things, looking at safe drinking water and food, waste disposal, and eventually vaccination, then we will actually reduce the burden of the poliovirus infection tremendously.
The month of October is breast cancer awareness. Have you thought about going for a breast exam? When a woman has a mammogram, the most important finding is whether there is any sign of breast cancer. And the second most important finding is whether her breasts are dense.
So dense breast is based on the mammogram images of your breast. One end of the spectrum, we have patients who have predominantly fatty breasts. And on the other end of the spectrum, we have patients who have predominantly glandular breasts. This is an example of a mammogram of the left breast on a patient who has predominantly fatty breasts. And as you can see, the background is black. And if she were to develop any masses, they would be like a beacon, like a chalk on a blackboard. This is an example of a dense breast. And as you can see, the background on this x-ray is very white. So for people with dense breasts, we often, advise them to get additional imaging. Mammogram is the gold standard for detecting breast cancer and for saving lives early.
The vaccination campaign against MPOX has been launched in the DRC, where there are more than 300,000 infections and nearly 990 deaths, according to the country's Ministry of Health. The ministry has received over 265,000 doses of vaccines. For more on the vaccination response, we take you to South Kivu, precisely to Kamanyola in the Walungu territory, where residents are already heading to St. Joseph Hospital to receive their first dose. A report by Ernest Mohero.
In the past 6 months, residents in the streets of Kamanyola, a suburb in the eastern part of the Democratic Republic of Congo, say that the virus had gripped their town following the spread of MPOX, a viral illness caused by the monkeypox virus. Authorities now say that they received 265,000 vaccine doses in October, and with the arrival of the vaccines, panic seems to dissipate, say residents like Salver Conde.
Before I was vaccinated, I felt really uneasy, especially since we are in an area that has been heavily affected by this pandemic. I felt truly exposed because I transport people from various places, often without knowing their health status.
St. Joseph Hospital in Camagnola is where people visit to get vaccinated, and first responders like Conde, who works in transportation, healthcare workers, as well as infected individuals will be prioritized, says Dr. Charles Messia, head of the hospital. Messia says children should be included in the next phase of the vaccination.
We have over 800 cases of children affected by MPOX out of the 1,400 total cases.
To date, South Kivu, the epicenter of this pandemic, has received nearly 30,000 MVA vaccine doses intended for adults, with over 45,000 individuals expected to be vaccinated, authorities say. Dr. Joseph Matundanya, vaccination programmer in South Kivu, says prevention efforts are vital at the moment.
The value of vaccination is to prevent the disease from spreading, as we are seeing now. The epidemic started in one health zone, and today it has spread to 32 health zones. The value is that when vaccinated, we strengthen the immune system against this disease.
With over 8,500 cases of MPOX and 45 deaths in South Kivu, the medical response, including free treatment, continues alongside the vaccination effort, officials say. The DRC has received 265,000 MVA vaccines from the United States and the European Union, the UN says. However, there is a concern over the issue of children who are not currently included in the vaccination. For Ernest Buhero in South Kivu, the Democratic Republic of Congo, Anthony Labruto, VOA Africa.
A new research suggests farmers could boost their profits significantly with a simple pair of eyeglasses to correct poor vision. But millions of people are unable to access such health care provision. Henry Ridgewell reports.
Growing cocoa is an intricate task. Farmers hand-pollinate the plants, transferring tiny pollen grains from the male to female flowers. For years, 63-year-old cocoa farm owner Juliet Adai from Ghana struggled with blurry vision.
It was difficult to work around my farm, to do the pollination, to do the pruning.
With the help of the US-based charity Vision Spring, Adai obtained eyeglasses to help with her poor vision. She says it has transformed her working day.
Before I had the glasses, I would get 8 to 9 sacks of cocoa a year. But with the glasses I have, I was able to work on the farm and get 12 sacks. So it has really improved my livelihood.
Vision Spring says half of cocoa farmers in Ghana's Asante region require eyeglasses to help correct their vision. Research conducted in Bangladesh by the charity and Queen's University Belfast showed glasses can increase income among rural workers by 1/3, from an average of just over $35 per month to over $47. The glasses themselves cost around $6.
A very modest investment in vision correction for farmers and for artisans and skilled tradespeople yields a pretty massive return on investment in terms of the household income that they are able to continue to earn.
The research was published in the journal PLOS ONE. Henry Ridgewell, VOA News.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at MkamitiVOA. Until next time, stay well and strive to make every day a healthy day.